Migraine is affected by hormonal changes throughout a woman's life. During the pre-puberty phase, boys and girls experience migraine equally. However, from the time girls hit puberty, there is a significant increase in migraine frequency among women, often resulting in a rate 3 times higher than that of men during their fertile years. They may experience a worsening just before and in the first few days of their period. The combined oral contraceptive pill may precipitate attacks during the pill-free week. Their migraines can often improve during pregnancy and can then worsen again during perimenopause, with attacks usually linked to menstruation. Although it may seem obvious, the connection to menstrual cycle both during and between periods often becomes clear only after keeping a detailed headache diary. Tracking symptoms for at least 3 months can reveal patterns and help determine if the migraine is truly exclusively related to menstrual cycles or if they occur at other times as well. If you experience migraine a day or 2 before or after the start of your period, and these are more bothersome than at other times of the month, we would label these as menstrual migraine. These are typically more severe, less responsive to treatment, and last longer than attacks at other times in the menstrual cycle. Research has indicated a decrease in the hormone estrogen as a potential cause. Sometimes effective symptomatic treatment is all that is necessary, or what we refer to as a mini-preventative. This involves taking a short course of non-steroidal anti-inflammatory drugs like naproxen or mefenamic acid, which can also relieve painful periods, estrogen supplements or triptans, but this relies on having a regular menstrual cycle. Other women may require hormonal treatment, such as a contraceptive pill, to suppress the menstrual trigger, while some may benefit from specific migraine treatments. During pregnancy, headaches can change once again. During this time, we face the added complexity of limited number of treatments available, along with hormonal changes, morning sickness, disturbed sleep, and increased stress exacerbating migraine. During pregnancy, women may develop an aura, and the characteristics of the headache may also change. If a woman develops a new headache or experiences a change in her headache during pregnancy, she should seek medical advice to ensure there isn't another underlying cause. After pregnancy, the frequency of headaches can also change, depending on whether you breastfeed, which may sometimes help manage migraine. There are various strategies we can employ to support women during this time. Some painkillers and preventative medications can be used, which can be discussed with your GP or headache specialist. Management must be tailored to the individual patient. The next phase is perimenopause, typically beginning in the early to mid-40s. Estrogen levels start to fluctuate during this period, increasing the likelihood of migraines. As with menstrual migraine, these attacks can be more severe, longer lasting, more likely to recur. Over time, as hormone levels begin to decline and stabilize, the frequency of migraine may decrease, but this is not immediate and is not guaranteed. Even though periods may have ceased, the ovaries can still produce some estrogen for several years. For treatment during perimenopause, it is crucial to discuss options with your GP or healthcare provider. If you are experiencing night sweats and hot flushes, starting hormone replacement therapy may be considered. If considering hormone replacement therapy, it is advisable to use transdermal body-identical estrogen, such as estrogen patches, gel, or spray, which can provide stable hormone levels as the hormone is absorbed directly into the bloodstream through the skin. Transdermal estrogen can also be safely used by women who experience migraine aura. Progesterone is also administered to women with an intact uterus to protect the lining of the womb from thickening. Other options available if hormone treatments are not suitable, for example venlafaxine, can be discussed with your GP and healthcare provider. Recognizing triggers often contributes to reaching the migraine threshold, and whether you experience an attack depends on whether you reach or exceed this threshold. It is essential to ensure that you don't skip meals, stay well hydrated, maintain a consistent sleep routine, and engage in moderate exercise. Additionally, talking therapies such as CBT can be beneficial. While it is challenging to avoid all triggers and exacerbating factors, you can try and find a balance. Managing migraine throughout a woman's life can be complex. A comprehensive strategy that includes careful monitoring, self-management strategies, and appropriate treatment is vital. Women experiencing these changes should feel empowered to discuss their symptoms openly with healthcare providers, ensuring they receive the support and care they need during this significant life transitions. By working together, we can navigate the challenges more effectively, leading to an improved quality of life.